Morning, everybody. I'm Sarah O'Brien. I'm the Chief Nursing Officer for Lancashire and South Cumbria Integrated Care Board, and I'm also Board Research and Innovation Lead. I'm really sorry I can't be with you today, but I was asked to just do a message to you all to share some of the work that we're doing in Lancashire and South Cumbria. We've had a research and innovation collaborative for the system up and running now since last July. And as a group, we've got representatives from the NHS, local government, our wider partners, public health, nurses, doctors, and I'm sure I've missed people out there, but we've tried to make sure it's an inclusive forum and it represents from right across the system. We've spent a lot of time since last July engaging with the group and coming up with our research priorities. So we've come up with a plan on a page for Lancashire and South Cumbria, and we've got 4 key research priorities that we're now going to be working as a system towards. One of those is about embedding research and innovation, and this is really about the capacity and the capability of the workforce, which I know is also a priority for the ARC. So this is an area where the ARC can really help us. As a nurse, I'm really passionate about the need to improve the capability and capacity across the nursing, allied health professional and maternity workforce. And that's one of our key ambitions and priorities in Lancashire and South Cumbria. Secondly, and linked to that, we want to establish better career pathways for medics and non-medics, but in particular for non-medics, as those career pathways aren't clear and remain a challenge for many who embark on research to then find a job or find a career that allows them to continue their research and their clinical practice. So we've got significant ambitions around growing non-medical clinical academic posts. In terms of our areas of interest, we also really want to focus on health creation and tackling health inequalities. And as a system, we had identified children and young people as one of our key areas of focus. And I know that's the theme of the ARCFEST today. And I'll talk a little bit more about children and young people in a minute. Our last ambition then is around commercial research and innovation and growing commercial research within the NHS. So that's some of the work that we're doing across Lancashire and South Cumbria, and the ARC are already a member of that group and working on that with us. But I'm sure there's many areas of our priorities that you can help us with. In terms of children and young people, I'm also the ICB exec lead for children and young people. We've got some significant challenges and areas of deprivation and inequality right across Lancashire and South Cumbria. And our integrated care strategy has got a better start in life as one of its core areas of priority, and in particular, school readiness. So many of our local authority areas are focusing on school readiness as an area of priority. So if there's anybody at ARCFEST today who's interested in that area as a topic, then internships or focusing research on that area would be really valuable to Lancashire and South Cumbria. Another area of focus for us is children's mental wellbeing and mental health. And mental health generally is one of our priority areas of research, but in how we help children and young people, again, we know from the work we do across safeguarding that there is lots of challenges in both education, health and local authorities around mental health in children and young people. So that's another real area of focus for us. So again, if during the discussions at ARCFEST today, that's an area that interests people, then internships or research projects focusing on children and young people's mental wellbeing and mental health would be of real interest to Lancashire and South Cumbria. Another area of challenge for us is SEND, so special educational needs and disabilities, which I'm also the exec lead for. And we've got significant, we've seen really significant rises in the number of children and adults who are being referred for autism and ADHD assessments. And we've seen a rise in number in diagnosis, and we've got significant waiting times for these services in Lancashire and South Cumbria. And we really need to explore different ways of establishing and managing these pathways and supporting children and families who are on that SEND pathway. So that is another area of challenge for us, that it would be great if we could align some of the focus from the ARC and some of the areas of priorities and the areas of research. And lastly, we are already working at the moment on a small bid around children in care and their wellbeing. So safeguarding, but particularly challenges such as neglect, domestic abuse and the impact on children and families, and things like violence in youth, and that they're all areas of focus for us as well. So other areas of interest around the children and young people agenda. So I hope you have a great day. I look forward to getting the feedback from colleagues that I've got there on how the day goes, and would be keen to obviously align the work in Lancashire and South Cumbria with the work of the ARC. Thank you.